More tests, more screenings, more checkups. We've been told our whole lives that more medical testing means better health. But here's what nobody tells you. After the age of 60, that equation can completely flip. I'm Dr. Eleanor Hayes, an internal medicine physician. And after more than 20 years of treating patients just like you, I've sat across the desk from too many people, good, careful, health conscious people, who were dealing with real harm caused not by disease, but by a test meant to find disease. Today, I want to talk about 5 medical checkups that I personally would think twice about after age 60. Not because I'm anti-medicine, not because I want you to skip the doctor's office, but because the best medicine is informed medicine. And nobody explains this stuff in a 10-minute appointment. Here's the idea I want you to hold on to through this entire video. It's what I call the benefit versus burden threshold. Every medical test carries two sides, the potential benefit of catching something and the real burden of what happens when it catches something it shouldn't. In your 30s and 40s, that math usually favors testing. But after 60, the math changes, and I want to show you exactly how. Number 1, routine PSA testing after 70. Let me start with one that surprises almost all of my male patients. The PSA test, prostate-specific antigen, is a blood test that checks for a marker that might indicate prostate cancer. It sounds simple. Just a blood draw. What's the harm? Here's the thing most doctors don't have time to explain. Prostate cancer is, in the vast majority of cases, extraordinarily slow growing, I mean years, sometimes decades. Research suggests that many men who are diagnosed with prostate cancer through PSA screening after age 70 will actually die of something entirely unrelated, heart disease, a stroke, old age itself, long before that cancer would have ever caused them a single symptom. So what happens when the PSA comes back elevated? It triggers a cascade, a biopsy, and prostate biopsies carry real risks, infection, bleeding, and in about 1 in 100 men, a hospital admission. Then comes the follow-up imaging, the anxiety, the sleepless nights. And if treatment is recommended, surgery or radiation, those treatments come with their own consequences. Urinary problems, sexual dysfunction, bowel changes, all for a cancer that statistically was never going to hurt that man. I've seen this with my own patients. A 72-year-old man, active, energetic, no symptoms whatsoever, gets a routine PSA, and 18 months later, he's managing the side effects of radiation treatment for a cancer that may have never needed treating. The U.S. Preventive Services Task Force now says that for men 70 and older, PSA screening is not routinely recommended. That's not a fringe opinion. That is the mainstream medical consensus. Now, if you have a strong family history of aggressive prostate cancer, or if you've had prior elevated PSAs, this conversation changes. Talk to your doctor. But if you are an otherwise healthy man over 70 with no specific risk factors, the burden to benefit math often does not favor routine screening. Stay with me, because the next one surprises women even more than that one surprises men. Number 2, annual mammograms after 74. Without reassessment, I want to be very careful here, because I know this is a topic many women feel strongly about, and they should. Mammography has genuinely saved lives. I am not dismissing that. But here's what most doctors don't have time to explain. Guidelines from the U.S. Preventive Services Task Force indicate that after age 74, the evidence for routine mammogram screening becomes significantly less clear. The reason it comes back to our threshold. Breast cancers detected in women over 74 are on average slower growing. They're less likely to be the aggressive types. And the treatments, surgery, chemotherapy, radiation, carry increasingly heavy physical burdens as we age. Research suggests that screening disease in women over a decade prevents roughly 1 death from breast cancer. 1. Meanwhile, approximately 12% of women who get a screening mammogram will get an abnormal result. And the large majority of those abnormal results are not cancer. What happens after an abnormal mammogram? Repeat imaging, ultrasound, sometimes biopsies. The anxiety alone, and I've seen this, can be genuinely damaging to a person's quality of life. Now, I want to be clear. If you are 74 and in excellent health with many expected years ahead, this conversation may be different for you. If you have dense breast tissue, a strong family history, or prior biopsies, absolutely discuss continued screening with your physician. This is deeply individual. But the blanket approach of every woman, every year, indefinitely, that is not what the current evidence supports. And you deserve to know that. Number 3, Routine colonoscopy after 75 in average risk patients' colonoscopy is another one where most people assume more is better. And again, for the right person at the right age, colonoscopy is a genuinely life-saving test. I have seen it catch cancers early. I believe in it. But after age 75, the calculus shifts. Here's why. Colonoscopies detect polyps, small growths in the colon that could over many years develop into cancer. The key phrase there is over many years, typically 7 to 10 years. So if a polyp is found in a 76-year-old, the reality is that polyp likely would not become a problem within that person's natural life expectancy. Meanwhile, colonoscopy after age 75 carries meaningfully higher procedural risks. Complications like intestinal perforation, a tear in the colon wall, are nearly twice as common in patients aged 75 to 79 compared to younger patients. The bowel prep required can cause dangerous dehydration in older adults, fainting, falls, electrolyte imbalances. I've watched patients go through the prep for colonoscopy and spend 3 days recovering from the prep alone, before the procedure even happened. The American Cancer Society suggests that most average risk patients can stop colonoscopy screening at age 85. The SPSTF says the decision after 75 should be individualized. What this means for you is if your last colonoscopy was clean and you are now 75 or older, have a real conversation with your doctor about whether continuing routine screening is actually adding value to your life. Number 4, full body CT scans and whole body MRI screenings. This one I feel strongly about because it is being marketed directly to people over 60 as a form of peace of mind. Concierge health clinics and wellness centers are offering total body scans as a premium service, and I understand the appeal. You want to know everything is okay. But here is the honest truth about whole body imaging in people with no specific symptoms. The human body, every single one of us, has what radiologists call incidentalomas. That's the technical term for incidental findings. Tiny spots on the liver, a small nodule on the lung, a cyst on the kidney, a shadow near the adrenal gland. Most of these are completely benign. They were there before the scan. They'll be there after. They will never cause harm. But once they are seen, they cannot be unseen. What follows a scan with incidental findings? More imaging to follow the findings, sometimes biopsies. I've had patients undergo lung biopsies for nodules that turned out to be old scar tissue from a childhood infection. Those biopsies carry risks. And through all of it, there is the relentless stress of waiting to see if it grows. Research consistently shows that whole body screening in asymptomatic adults leads to a high rate of additional testing, significant psychological distress, and very rarely, almost never, a meaningful change in health outcome. If you have a specific symptom, a family history of a specific cancer, or a targeted clinical concern, imaging makes sense. But a whole body scan is a wellness product. For most people over 60, the burden almost always outweighs the benefit. Number 5, routine annual EKG after 60 in low-risk patients. This one surprises almost everyone. We assume the heart is the number one thing to watch, and it is important, but here's what the research actually tells us about routine annual electrocardiograms, EKGs, in older adults who have no symptoms and no known heart disease. The USPSTF has concluded that routine EKG screening in low-risk, asymptomatic adults does not reduce cardiac events or mortality. It doesn't change outcomes, and here's why. The EKG is a snapshot. It measures your heart's electrical activity in that exact moment. A problem that shows up on an EKG in a person with no symptoms typically doesn't tell us what to do about it. What it can do is find something ambiguous, an irregular rhythm, a slight abnormality that may or may not mean anything. And that finding leads to, you know the pattern by now, more tests, a stress test, an echocardiogram, maybe a cardiology referral, months of worry. Meanwhile, if you have symptoms, shortness of breath, chest discomfort, palpitations, unexplained fatigue, an EKG is absolutely the right call. If you have high blood pressure, diabetes, a prior cardiac event, your doctor may have excellent clinical reasons to monitor your heart more closely. I'm not telling you to refuse an EKG. I'm telling you that for a symptom-free person with low cardiac risk, a routine annual EKG is not supported by evidence as a standard screening tool. Now, here's the one most people don't know about before I close. I want to give you the insight that most of my patients find the most genuinely surprising. The biggest myth in preventive medicine after 60 is this, that the goal of every test is to find something. The real goal of good medicine is to find the things that, if found and treated, will meaningfully improve your quality and length of life. Those are not the same thing. Finding something is easy. Finding something that will actually help you, that requires wisdom, not just technology. In my 20 plus years of practice, the healthiest patients I've seen in their 70s and 80s are not the ones who had the most tests. They are the ones who had the right conversations with their doctors, the ones who asked hard questions, who understood their own risk profile, and who made decisions based on evidence rather than fear. 3 questions to ask your doctor. Here's what I want you to bring to your next appointment. Ask your doctor these 3 questions. 1, based on my personal health history and risk factors, not general guidelines, which of my current screenings do you think are still giving me real benefit? 2, if this test comes back with an abnormal result, what are our likely next steps? And do those steps carry risks I should understand? 3, is there any screening I've been doing routinely that, given my age and health status, you would now consider optional? These are not confrontational questions. They are the questions of an engaged, informed patient, and any good doctor will welcome them. Closing, I want to be clear about something because I know this video covers a lot of ground. I am not telling you to stop seeing your doctor. I am not telling you to cancel your appointments. Regular medical care after 60 is essential. There are screenings, blood pressure checks, cholesterol management, diabetes screening, bone density tests, vision and hearing assessments, vaccinations that remain genuinely valuable at any age. What I'm saying is this: you have a voice in your own healthcare. You are allowed to ask why. You are allowed to understand the risk on both sides of a decision. You are allowed to weigh your own values and quality of life in these conversations. The benefit versus burden threshold I talked about at the start, it's real. It shifts as we age. And knowing that it shifts is one of the most powerful things you can carry into your own healthcare. Age well, ask questions, and please advocate for yourself. If this video helped you see your healthcare differently, I'd love for you to subscribe. Every week I share research-backed health insights, the kind of nuanced, honest information you deserve, but rarely get in a 10-minute doctor's visit. And if you found this helpful, share it with someone you care about over 60. These conversations matter.